Okay, we're good.
All right, thank you.
You're welcome.
Welcome, everybody, to the December 2nd, 2025, 6 p.m. Citizens Police Review Board monthly meeting.
Recording in progress.
Alrighty, so are we okay with feedback?
I think that's mine.
Okay. You have it up both on the phone and the computer? Testing? Nope, still there. Testing? I think we got it. Beth, did we lose Beth?
She's muted, that's all.
Okay, all right. So again, welcome to the meeting. We have some excused members tonight, right, Beth? You're on mute. You're on mute.
My apologies, Madam Chair, members. Mr. Kotler, Ms. Shields, I don't believe has arrived.
Nope.
And
Davis.
I think that's it.
Okay. So Mr. Davis won't be here, and we don't know about Ms. Shields.
Mr. Davis is here.
Okay.
You have a quorum. You're good to go.
All right. Thank you so much. Alrighty. So our first, after the remarks here, is to approve the minutes that we received. With the October 28th meeting minutes that we need to approve. So you got them probably a week or so ago, maybe like the 23rd or something. They came through. So do I have a motion?
I'll make a motion.
Thank you. Do I have second?
Second.
Thank you. Discussion? Hearing none. We have a motion and a second. So all in favor by aye? Aye.
Aye.
Opposed? Ayes have it. Thank you. We have a guest tonight, so I'm going to turn this over to Beth so that we can hear from our guest.
Thank you, Madam Chair. You had a discussion at the October meeting about the co-response unit operating out of the Office of Community Health and Safety from the Department of Public Safety. There had been some controversy related to a change in their practice. They had gone from a co-response model that included mental health professionals riding with police officers as a team, and they would go out to incidents where their support and intervention might be appropriate. That model was disbanded, that unit was disbanded, and the unit or the response now is solely from a practitioner's standpoint, that the mental health professional, a clinician, a social worker through OCHS will go to a scene if it seems that their support would be effective and appropriate. The law enforcement side of that team is no longer operational. That has been changed. I believe there may be one officer who is still responding to mental health incidents, but they're not responding any longer as a team of law enforcement and civilian practitioners going together. We asked that representatives from that program, the Deputy Director of Public Safety, Camilla Alarcon, that she could come tonight and provide to you an overview of where they are, what they intend for the future, and maybe share with you some of the successes that that unit has had during their operation as a team with law enforcement, and now in the model that they've adopted. There are also other units in OCHS that they may be able to touch upon that have been very successful, and they remain in operation. I'm thinking of the Roots program, their post-overdose program, where there are quietly going about supporting people at some level of crisis. That is different from the co-response unit that we came to know and that we're going to hear about tonight. So if you have any questions or you want to follow up with anything, I'm sure that Ms. Alarcon or her representatives would be happy to answer them or get back to you or whatever we might be able to do. But it's an opportunity to have that discussion now. I see that. Who wants to take it? I see Mr. Hudson's here. Ms. Zeke, Caitlin is here.
Yeah. Hello. And
Why don't you go ahead and you take it from here.
Thank you.
Thank you.
Thank you, everybody, for having us. My name is Camila Alarcón. I'm an assistant director in public safety, but I oversee specifically, as Beth mentioned, the Office of Community Health and Safety. So just for a little bit of context, this office was established in 2021 out of a big need of, as Beth and I've talked in the past about some of those gaps that we're seeing in the county and in our city, particularly focused on the gaps we're seeing in mental health, substance use, homelessness, and anything relating to extreme poverty, but also the criminalization of folks who are committing low-level and nonviolent crimes out of necessity and survival. I think I was the third employee hired in the office. I was hired to develop the law enforcement assisted diversion program, which we can talk about also after we talk about the crisis model. But this program is an international program now. I think they're in almost all states and in Mexico, South Africa, Australia, and the UK. And we work closely with police to divert folks into intense case management, but wanted to talk to you about this pivot that we did around the co-response program. The co-response program was launched in April of 2023 as a way to pair clinicians and police officers with together and respond to specific mental health crises. So we've been monitoring this program for now almost 2 years and a half, and just seeing the evolution of it. So in the fall after, and Caitlin she's our clinical manager, she's gonna take over. We created a presentation, but we did pivot due to some resources, specifically, lack of resources within public safety. We had to pivot the program in order to make it sustainable, and in order for it to not have to close or maintain in just the 3 zones that we were operational. So we were operational in Zone 1, Zone 2, police zones 2, and Zone 5. And so the plan was always to be citywide, and this has been a struggle that we've had to look from the side of public safety resources, but also OCHS resources. So in the fall, we changed the model to mirror what all the teams in like Pennsylvania, except for I think 2, and Caitlin's going to talk more about this, where folks are paired together. So mental health clinicians are paired together, but we still partner with police. I'm just going to let Katie talk through this presentation. And then after the crisis response, we'll take all your questions. And I also prepared some slides regarding the Office of Community Health and Safety. Katie, take it away.
Thank you guys so much for the platform to speak about the program. My name's Katie. I am a City of Pittsburgh native. I'm a graduate of Pitt's MSW program. I've been adjunct faculty there. I'm a licensed clinical social worker in the state of Pennsylvania. I've worked with first responders closely for the last 10 years. And most recently, prior to working with the city, I developed the co-response program for the University of Pittsburgh. And we published a guide of national best practices on how to create a successful co-responder program. So what I'd like to do is kind of go through some of the changes that we have made. Keep in mind that a co-response model is different than an alternative response model. So we still do co-respond with law enforcement as well as other public safety bureaus. Whereas alternative response means that that unit would go without any additional public safety support. So just to clarify in the beginning, we are not an alternative response model. We are still a co-response model that works with all three public safety bureaus. And I will get through my portion and I will absolutely take questions, but I want to make sure that we get through everything so that you guys get a good picture going forward of what the program looks like. Okay, so Director Alarcon talked a little bit about why to evolve this model. So as someone who's been in, the clinical mental health field now for 10 years and I working almost exclusively with crisis situations, this model gave us, and this program really has given us a lot of opportunity to see how we can make improvements that really work best for the residents of our city. As you know, we have a lot of very diverse populations in Pittsburgh, and we have a lot of, individuals who experience a crisis, specifically mental health, and we want to make sure that we're providing the best and most trauma-informed model we can. So a few reasons why we're pivoting to this co-response model. So it's important for us to have a behavioral health response to a behavioral health crisis. I'm a huge believer in the fact that we need the right responses for the call, right? And so in situations where we do have a significant behavioral health crisis occurring, it's important that we have the clinical staff on scene to provide that response. We also wanted to make sure that we were strengthening our follow-up and case management and just reliability with circling back to folks. When I had spoken with Beth a while ago, we talked about, what happens after the calls. And so what we found was it was important for us to still be able to make time to circle back and connect folks to care after the crisis. So that was something that we wanted to prioritize. We do need to address sustainability challenges of the dedicated police clinician pairings. I'm sure you know that we, most cities, right, are having a police shortage, and making sure that we have enough officers, for things like the downtown foot patrol or the Southside Entertainment Patrol. There's a lot of individuals in this city that want to be ensured that there are enough police officers available to do their job. And so we want to make sure that just because we may not have enough police officers, that we didn't want this program to disappear. That was really vital for us, especially, now that we're putting more of a focus on that mental health piece. We also wanted to broaden engagement with more police officers. As you can imagine, having a dedicated police pairing really kind of takes away our opportunity to work directly with all of the other police officers in those zones. And I'll talk a little bit more about the benefits of what we've been seeing with that as well. And we really wanted to also increase opportunities to relationship build and make sure that, we can provide as many people with education, resources, and support in the community in the context of that crisis moment. Best practices and standards. So I think you can argue that there are all types of different models that work for different reasons. But we really want to focus on a public health-led crisis intervention. We want to follow the national models that are, now pivoting to the idea of having the clinical pairing to ensure that we have a good idea of how to handle a call with that behavioral health crisis need, and make sure that regardless of what officer is on the scene, that you still have a team that's able to effectively work and de-escalate that mental health crisis. So what is changing? Not a whole bunch. We are still out there and we are working these calls. We have a more flexible and trauma-informed response. So what I love most about what we're doing now is that, just within 6 weeks, we've been able to encounter and engage with dozens of officers that we've never been able to work with before. We want to strengthen those relationships and continue to model the crisis intervention training principles. Another piece that looks different is that our team is only dispatching to behavioral health calls. We're not going to parking complaints. We're not going to neighborhood disputes. These are calls that require our specialized response. And so being able to be dispatched, which we'll talk about how we're dispatched to these calls, it ensures that we are focused on the specific calls that we know best. We can also remain on scene and provide stabilization and follow-up after the first responders clear the scene, which can be incredibly helpful if you're an officer who has somewhere to go where it's the end of the shift and you need to write a report. Our teams can hang out and work with someone to ensure that we're not just there and gone, and that we can provide that follow-up. We now operate independently of a police schedule for reliable coverage. I do have data on our reliability as far as coverage goes, and we also are now in non-police vehicles. The previous teams were riding in a police cruiser that, said City of Pittsburgh Police on it, and these vehicles are now just city branded non-police vehicles, and what continues is that our teams do not wear anything, police related, right? So, a more civilian community comfort and obviously reducing stigma as well. I'll talk a little bit more about the police car. And a big piece, when you think about clinical case management, is that police records and protected health information, it's a little bit dicey because protected health information is something that belongs to a person's, record, and that can be a mental health record. So if they go to the hospital or if we're referring them to any sort of treatment or services, those can be kept separate from police records because we want to make sure that while we work with folks on a voluntary basis, that, we want them to be aware that their information is confidential, and only in certain situations can we share that with law enforcement. We also are directly transporting voluntary individuals to crisis walk-in centers or shelters. We've done this a lot with folks that, we know very well in the community, and they will typically call 911 for a ride somewhere, which you can imagine is not the best use of a 911 resource. So we've been able to do that in our civilian vehicles, and take folks in a car that doesn't look like a police car. And we also find that with our ability to stabilize a situation, oftentimes, especially if these are chronic callers with a very chronic serious mental illness, typically officers can return to service. Sometimes we might be there for an hour, de-escalating folks. And officers like that, they do, because they are typically going to these calls 3, 4, 5 times a week. And so when we can intervene and provide that stabilization, typically things, kind of fizzle out after a little while with, a typical escalated situation where someone needs a cigarette or they want to have a conversation about something. And then the officers are able to leave the scene. The benefits to these changes, I think, really focus on stronger collaborations with all of the police department across the city, and more crisis expertise on the scene. So we will be, again, working with all officers across all zones. Hopefully by the beginning of the year, we'll have our final team in place. We should be working together and problem solving together. And having that real-time clinical consultation has been incredibly helpful for officers on the scene, as far as determining sometimes a disposition that they're not necessarily sure what the best road to take is. Again, we are only focusing on behavioral health and social service calls. I have a list of what that entails, just so you can get a broader picture of what a behavioral health or social service call is. And we kind of talked a little bit about these things already, but again, improved access and community trust. We found that it really reduces stigma and increases community engagement while not being in a police vehicle. I think that, police presence is challenging for some folks, and especially folks that are experiencing a mental health crisis. Being in a police car can feel stigmatizing and criminalizing. And so for us, we have a lot of folks that will approach our vehicle because we're not in a police car. And we will have conversations about, can you help me even just find somewhere, right? Someone that's, driving around and lost in the city. They've actually pulled over next to us and asked for help. So it's nice that the appearance of the vehicle and all that comes with that creates a little bit more comfort and trust with folks when we're engaging. And again, obviously the police are there and they're in their police cars, but for us, we get to have a little bit of a separate entity that can divide us in that way. The things that are going to remain the same, as always, we are continuing to work with police, all of Pittsburgh police. We have been in situations with University Police, Port Authority Police, Sheriff's Office. As long as they're a first responder bureau, we're there to work with them. And scene safety remains a prerequisite before we're involved. So the co-response team with an officer was not allowed to be the first unit on scene because carrying a civilian in a vehicle means that the officer's first priority is the partner that they have in the vehicle that's a civilian. So we still do not engage in the scene. We can arrive to a scene, but we don't engage until officers let us know the scene is safe. We're still giving our feedback and interventions during these crises, and we're making sure that our decisions are trauma informed based on the situation, the type of situation. Are there kids involved? Is there substances involved, domestic violence? And we're making sure that we're providing that support at every encounter. And we will continue to advocate and support residents and destigmatize these mental health challenges, especially during law enforcement responses. We recently have the incredible opportunity to now be dispatched by County 911. The Allegheny County A-Team has kind of paved the way for us and just done incredible legwork on this process. When I talked to the dispatch supervisor there, the communication supervisor, they said it took about 3 months to really get things off the ground and running with the county's crisis team. And so a lot of this infrastructure has already been built. And so for us to kind of just almost nearly copy and paste into what the county's doing within the city limits, it's already going really well. We give this opportunity now for first responders to request our team via the radio. They can also be suggested to respond to a behavioral health call, or if it's calls that we've previously engaged with. Again, as you can imagine, there are some folks that we will see many times a week. And so typically when those are known addresses, they will know to reach out to us from previous call logs. The 911 dispatchers log that request and they assign the unit. So we do have a call sheet that I send to county dispatch at 5 a.m. Every day with who's working, what unit, what zones, the times, the phone numbers. So it's very easy for the city's dispatchers to know who to call and what locations they're in. They are housed within the zones, so they're not all at a central location. They're working within the zones that they're covering so that we keep response times very quick. So they dispatch to us and we say, okay, we're about 5 minutes away. they'll let the officers know, or the first responders know, that we are en route, and they'll keep that call open until all units, including our unit, clears and closes with a proper disposition. 911 can also notify us immediately if a scene becomes unsafe. So obviously, sometimes that's going to happen if a weapon is present, or if there's a threat to harm to another person, they will let us know, not to come into the scene. And we can also let them know if we're leaving a scene due to safety concerns. So the team and community safety is present at all times. We're having success with the dispatch process being quicker at times, because we will not be with any other officers on any calls. So we're only, again, if there's a behavioral health call coming, we're going regardless of what officer is available. And the nice thing about that too is then whatever officers are available, they will arrive first to the scene, and then we will already, kind of have some established contact at the call. Briefly, I want to touch on the types of calls that we go to. So mental health crisis is broad, but this is an individual whose, their current circumstances are overwhelming their ability to cope with life. Now that can look like a whole bunch of different things for some folks. Individuals that are contemplating suicide, or are taking steps to act on suicidal thoughts, which typically around these months and in the colder months, we see an influx in bridge jumpers. Folks around the holidays, January, February are the highest months for suicide attempts. And so those calls are really important for us to be at, because we know that in those situations, it can truly be life or death. We can assist in situations where there is community violence. We certainly have wonderful offices within the city and the community that specifically work with violence intervention and violence prevention. But sometimes, there are individuals on the scene that have been traumatized by what they've witnessed, and maybe we're not working with the victim or the perpetrator. We're working with folks who may just have been bystanders to a very scary situation. Folks who are being evicted it's a very traumatizing experience. And so for folks that are essentially being forced out of their home in that moment, we provide support and ensure that we can offer them a ride to a shelter, or, anywhere that they might need to go in that moment, to make sure that, they're not just out on the sidewalk with their belongings. We go to calls involving folks who are deceased when we arrive, or also unresponsive persons. So people who could be outside, unconscious. You can imagine in the cold months also, we have folks that are sleeping outside in freezing temperatures. And unfortunately, folks in the morning who, typically are walking their dog or getting ready to go out for work, they will find an individual, frozen outside. That's obviously very traumatizing and scary for folks to encounter. So we do provide support there, as well as, if there are, maybe family members that need notified after the police would do so, we can provide some sort of support and just connection to something other than just, hey, this person has died. And those are typically in situations where either it could be something like that. It could be a drug overdose. It could also be sometimes folks who, which I have bystander CPR on here, folks that are giving CPR. We have a lot of older adults in the city that go into cardiac arrest. And we typically go to those scenes as well to support family members, as that's watching someone receive CPR is also very traumatic, or giving it is also very traumatic. So we try to make sure that we can attend to those individuals. We will get involved in situations with domestic violence, typically with the victim. We have situations where the perpetrator and the victim are separated, and we will work to try to ensure that that individual, has a safe place to go. Do they need a PFA? Do they need resources, support? The same with sexual assault. We offer them resources, rides to the hospital if they'd like a sexual assault kit done. child welfare, we don't get too deep into working with children, obviously, because that's a whole different realm of consent for services. However, there are often times where children will wander away from their house. We've had many children that are, toddlers, 3, 4, 5 years old, that kind of wander out the front door. So we will assist in locating and then reuniting children with their appropriate guardians. Large scale incidents, fires, disasters, shootings, and things that may impact a lot of city residents. Okay, so I'm getting close to the end here, but I really want to hit on the data, because I think that the opinions that we carry about how we think something may or may not be effective, I think can be their opinions, right? And so the best practices, or the way that we can actually identify what is working and what is helping, is through data collection. So it's important that, when we come into these spaces and speak with you guys, as well as the folks in the community, we want to make sure that they understand that these changes are not, for nothing, right? Or a decision on a whim. And as someone who really prioritizes the mental health of vulnerable people in the city, we've found that this has already been working relatively well. So we did some comparisons from last November to this November. We have had an increase in active responses that our teams have been able to go to. We have started the model October 13th, so very recently. We've added another zone, so we are now in zone 4. And in those 6 weeks, we've had 98 calls for service. And you can see that zone 5 makes up almost half of our calls. So, it's been a priority to be in zone 5. And, our volume has always been relatively high in zone 5. And so it's been really important for us to continue to maintain that and make sure that we're engaging with the residents there. And especially for mental health crisis calls, we want to make sure that we're getting to as many as we can. And you can see that zone 4 is already, quickly climbing in a number of times that we've been able to engage with them. We have a 10-minute average response time, which compares typically to most of the active responses from public safety. If we sometimes we beat police or EMS there, we will wait for police to initiate that call. But working in the zones is a similar model to the officers. So we're not coming from downtown, going all the way, over to the East Liberty area, or, we're not crossing the entire city. And so that makes it possible for our response time to be quick. As we know, crises can escalate quickly, and so we want to make sure we can get there to de-escalate quickly. So the model that we previously had with a designated officer pairing, this table on the top here shows a comparison of the last 2 months that we had the designated pairing process with a designated officer. We had a total of 32 and 48 responses, but we also had vacancies due to, again, officers will get sick. They'll take PTO, especially, ones who have been there for a long time. They have accumulated a lot of time off, and it's important that, they can take that. But in doing so, that keeps our shifts from being fully staffed. And so, as you can imagine, that then puts a burden on how do we get to those calls that are coming in if the unit can't operate because we don't have an officer. So we did only have half of our shifts in August and 71% in September that were fully staffed. Now with the model of 2 clinician pairings, an officer is always going to arrive to a scene. So somebody's not going to be on PTO. And so we are able to get 50 responses, which is higher than the previous 2 months. And have 100% staffing coverage. We have not had a vacant shift since we started. And additionally, we wanted to highlight, there was talk, I think, in some of the meetings about, why we should have 15, 20 social workers. We wanted to highlight ways in which we've increased applicants to these positions. So you can imagine that this job in crisis work is challenging as it is, and finding someone who is willing and equipped to do the job is important to us. And for a lot of folks, the application process, a deterrent was riding in a police vehicle for the duration of their shift for those 40 hours a week. So in August, September, October, those are the amount of applications that we had. November 13th, we posted the new position that designates the 2 clinician team pairing, and we've already had 13 applicants, and we've already begun screening those candidates. They're phenomenal, qualified folks, licensed mental health professionals, and it's important for us to fill these positions because, again, what this program is here to do is support our residents. And if we can't staff the program, we risk losing the program. And so my excitement about, getting this many applicants and folks that are really looking forward to jumping in and working in the city. I'm excited about having those folks on our team. And I'm also excited that, we'll be able to fully staff the entire city for the first time since the program's inception.
How many positions will you have open?
So we are currently working with 2 full-time positions that are remaining vacant from this current budget. And I think we're still working on determining if we're going to get more of those back in the budget for 2026. And so oftentimes—
Katie, I can answer that question just because I was just at council. That's a great question. So we had, for 2025, we had 15 clinicians originally budgeted, but when the city was trying to balance the budget, they always look to cut positions that have been open for a long period of time, so they don't have to cut folks who are in positions. So unfortunately, this was one of the reasons we also had to pivot, because we had over 10 positions eliminated that were open that we couldn't hire. So we currently have 4 clinicians who staff 2 units, and we were left with 2 other open positions. That would allow us, with this new model, to cover the city. Mm-hmm. Really, with the conversations that we've had with public safety and council and OMB, I understand that they put back 8 positions back to our budget, but that is depending on if council approves it in the next couple of weeks. With those positions open, we could have 2 teams per zone and explore that PM shift that we've always wanted to fill and the weekend. So currently we only have 2 positions left open. And in the previous model, with only 6 positions, we weren't able to really expand for coverage. So doing this new model now, even if council doesn't approve those 8 back, we can cover the city. But I did see them come back up, and so they're going to have to vote on if that is something that they want to approve in the next budget.
Thank you for answering that. And I think too, when we're thinking about the sustainability of a program, why we have the program is to support individuals that need our help. And so one of these barriers was, if we can't staff these positions, let's ask ourselves why. We kind of broadening the scope in hopes that we would get a bigger pool of applicants. But once we shifted that, I see a hand. Once we shifted that, we were able to begin getting applicants very quickly.
Yeah, my quick question is, and I'm sorry I had connection issues, so I may have missed something. But I'm Sheldon Williams. First of all, let me introduce myself to our guests. Are we waiting to the end? I have a question related to some of this that you just said, and should I hold that till you finish the presentation, or are we offering questions along the way? And I'm only asking that because I lost connection and came back.
That's okay. I have actually, I think, 2 more slides if you guys want to wait, because just in case I answer any of those questions, I will be super quick because I know I'm I'm chatty. we are strengthening our relationships with the police. And I think that the misconception of, what was put out there is this concept of, disbanding a program. I think that's really harmful language to use when we found this to be so beneficial to the community. We are strengthening relationships with police by working together, by working with more officers. We are seeing officers in a helping role instead of a law enforcement role. So an officer can stand next to me in a situation and provide support instead of enforcement. We are building trust with the repeated contact of folks in high need areas. We're diverting, which is also a really, really beneficial thing, is we're diverting folks from the ERs or arrests because we can help work with those residents to avoid criminalization when possible. And I think that we're really starting to build stronger relationships with vulnerable populations as well, which I think carries into most all of our OCHS programs, is that, because we're working so closely with folks in the community, that benefits us in working when we bring folks like police, fire, and EMS in. Okay. I am on the last slide. So I wanted to just briefly touch on some things that we've been able to do since changing the model. We are not fully in zone 3 yet. However, we are still providing assistance to them. They are getting a lot of mental health related calls in that zone. And so what we're doing in the interim is trying to provide as much support as we can to zone 3. We also were able to provide them with our private link for referrals for follow-up. We've had the sergeant in zone 3 send that out to all officers, and they've been providing us referrals for folks that they're hoping we can check in on outside of their calls. That's been really, really helpful to bridge the gap between, we don't have a team yet for you, but here's a resource that we can provide you. We've been able to go to some calls and start working with the officers, and they're super excited and grateful when we've been on scene, and are really looking forward to having us. One of the officers said, we're not the experts in this area, so seeing you guys show up is kind of a relief. We are now in zone 4. We have a considerable older adult population in zone 4, and specifically folks who have some hoarding behaviors. We've partnered with our another program that I manage that is social work related, that does more long-term support and engagement. So we've been able to do a lot of referrals for folks that are frequently calling 911 for falling in their home, or having those types of issues. So we've been able to connect them to more long-term support. We're starting to get some early calls for assistance in the morning. So we've been able to engage with some of the night shift officers. Of course, they would love to have us. But right now, obviously, our priority is staffing citywide. And they also are provided this referral link. So if they go to a call at 3 a.m. and they'd like us to follow up on it, they can send that referral and we'll get it first thing in the morning. We're transporting folks to shelters, to their house, to appointments. Folks that don't have any other way to get somewhere, that need this appointment or need this connection to care. And we're destigmatizing, or sometimes even avoiding, the need for a transport. And we're also providing a more holistic approach to care. We're providing support outside of a traditional response. We're meeting needs that take more time. So sometimes if someone is in crisis, a crisis looks different for everybody. Their crisis could be that they don't have any food in the house. They don't have a way to pick up their children from school. And so we're trying to find the root causes and to the crisis so that we can reduce those as quickly as possible. I think we're going to go into questions now about anything crisis related, because I know that was kind of the main bulk of what we were talking about tonight.
Questions?
Yes, I had a couple questions if I can jump in. So first, thank you for the presentation. That was really good. I know I shared with the board last month, I attended the Zone 5 Public Safety Council meeting when the commander our acting commander, and I think a council member Gross kind of shared the update on the change. And I had a lot of questions based on how it was presented at that time. And so you definitely answered several of them. I still have a couple. And I guess, first of all, you talked about being able to engage with more of the officers in the zones. I guess, and I've had this concern for some time. How does, you talked about many of the officers starting to see this and get it and recognize that. Are you still seeing or encountering some officers who are opposed to this? Because I do know officers still feel that this isn't policing and give us more cops. I'd rather have another cop to get my back. So kind of have a question about that. And if you can comment on that.
Sure.
Yeah, I'll stop there. Yeah.
Okay.
I
Perfect.
can just add for context, just from the beginning, before 2024, when Katie joined us, that was one of Mr. Robinson, that was one of our biggest challenges. Like the officers, even with the co-response model, it took a long time to even get that buy-in. Even, in downtown, our current unit, a lot of the time there was speak of like, this is not real policing. You're just plain police officers. This unit is the homeless police. And so that has been something that we've had to really deal with at a level of buy-in from police. And what we tried to do before we shifted this model is do what we call the CRIT training. So it's the crisis response intervention training. So we hosted 3 this past year and 2 the year before, where we do a more intense training with police. So we have our clinicians and police, and we train beyond crisis mental health. We do neurodivergence, we do ADA, we do all types of training to try to destigmatize and have a more of a harm reduction approach. And we, that was voluntary, and we had little participation, but as we continue to do more, we had more participation for officers. What I will say now, what we're seeing is a lot of folks in police feel like this is a way that they can go back and respond to emergencies. So a lot of the debate happened because a lot of the times police had to stay on scene, not only the co-response scene, they would have to stay on scene for like over 4 hours dealing with a crisis. And that would really frustrate them because they would tell us, well, then why do we have this police unit that comes to the scene if we also stay? And then with this new scene, what we can do is we stay and then they can go back to respond to public safety. But we were also having our clinicians sit in those cars because they didn't have independence and mobility in traffic stops, or whenever they would do what they call like waking up folks very early in the morning. That kind of creates like an ethical dilemma for our clinicians. So a lot of the times they would spend hours inside of the car without being able to do a lot of work because of the relationship, that obviously different relationship between police and clinicians. But I think Katie can talk about like now that we work with more officers. Before we would only work with the designated officer and whoever that officer knew who was calling. Now these officers are seeing us independently of any other officer. And I think that has created for them, okay, you're here, we can leave, and let me call you again. But Katie has been in the unit every Friday now since it launched. And she could talk more about like how we do still have, I'm going to be honest, we need to have more buy-in from police. That has been a struggle since I started in the office in 2021. As you know, this is like a new way of reimagining public safety. So I really appreciate that question.
Yeah, I think that some of the best outcomes for buy-in have come from working a call together. I think it's hard to envision what that might look like when an officer says, oh, well, why would I, want this person on scene when I could have someone else? And I think that when it comes to these particular types of calls, they see that it alleviates some of the burden on them. It also helps de-escalate the call. It provides them a level of support that, yes, it's not a police partner, but we've gotten to a point where we've never been turned away from a scene. We have officers that are just so positive and engaging. And I think that that's the thing that I really want to try to grab hold of and expand on, because I think that a lot of times that, comes from the top down. So I've been trying, myself and Director Alarcon have been trying to work with some of the leadership within police to make sure that they are also openly supporting, we should be using these resources. These are great resources, because the officers that use them have just very, very, very positive things to say. And again, we get to touch as many of those officers as we can on a shift, so that they get to see that direct interaction with us, and that in turn helps increase that buy-in.
Mr. Williams has a question.
Thank you.
Yes.
Thank you. My question, and I'm going to state it this way to not like softly endorse one model versus the other, but I am a big advocate for this type of response. Given my own background of crisis moments from a tactical perspective, they have turned very, very intense to my own counseling background. So I come with some experience here. My question is, was the decision for the switch because we weren't staffing correctly, and so we went from co-response to alternate response, or was it best practices that was reviewed? Because it almost appears as if, based off of the data that you gave, is that because we weren't fully staffing, that a decision had to be made. But I want to understand the efficacy of our efforts, not necessarily the decision that was made, just based off of us not being able to respond appropriately.
Yeah, that's a great question. I think this year was a year of transition for the team, because we were able to expand to a third zone. So we were able to have more data in our software database. We have a database called Gelada, which houses protected information, but also healthcare information. And what we started seeing was what you're mentioning, a lot of calls we were getting sent to calls that were not mental health focused. They were calls that didn't involve a crisis. They were calls that were not tagged to 911, which was very concerning, because then we were losing a lot of folks that needed our help, because these calls were not tied to a 911 call or a mental health crisis. So that was one thing that we started seeing. The other thing we started seeing was this lack of resources in public safety, right? Like including police, but also from our own. We were getting a lot of feedback from folks. We have 7 other programs in our office, and we were getting really qualified clinicians apply to jobs that were paid less than this position. And so we started talking to people in Stanford, in Pitt, in different other kind of universities, but also other programs that have co-response or CRT models. And they were experiencing the same, particularly because of the lack of independence of clinicians, right? Clinicians didn't want to be assigned for 8 hours in the same car as a police officer. So we started trying to figure out how we could manage that. Additionally, with police, we had a list that was, because there was a specialty unit that was expiring. And there was not a lot, we went through a couple of police chiefs. So there was not a lot of like real commitment of kind of going back to the list or having that process again. So we were going to be left with really no officers to fill that citywide. And then aside from that, we've been working with the county to do billing and get paid through health choices, so that we are not a burden on our city budget, but we can be more sustainable. And so when we started exploring that, we started seeing a lot of also best practices, but from an operational standpoint, SAMHSA and the state is moving to being more willing to do those billings if we have a 2-clinician team versus 1 clinician and 1 officer together. Mainly also it has to do with documentation. The documentation burden was left on the clinician. And so that could create a lot of gaps in reporting. And then obviously Katie had been going to like different conferences and meeting with national experts, where because of these obstacles that we're seeing in Pittsburgh are happening in Baltimore, are happening in New Orleans, are happening in different other similar cities Cincinnati, and they were pivoting like we were pivoting. So we wanted to make sure, like, it almost was like the perfect storm. And then we also had to hear our clinicians, right? Our clinicians were getting very frustrated by the way the model kind of limited their efficacy and interaction with the public. Like I said, for example, in some of the times they were sent to do traffic stops for 5 hours. That's an entire shift. Or to do homeless checks when we have our own homeless outreach team. So we also had to listen to those folks and some of the conversations that were occurring in the cars. If I can be very direct and open here, some of the conversations that were happening were kind of violating ethical things from the social workers and from the clinicians, as well as how to approach certain situations. So we started piloting 2 clinician units. And what we got was, I have someone else who's clinical who can help me with what is the best decision for this person. So I guess it wasn't one thing, it was a lot of situations that we were encountering. And I have to say, the program was successful. Like, the program did have a lot of good outcomes. The teams did a lot of good work. It was just not going to be sustainable to remain it as is in our current environment.
Well, I'll just close with, and I won't ask another question, but I want to give some assurances to the board. I appreciate the desire to understand this more, but I have firsthand knowledge that the mayor-elect, the chief-elect, and the public safety director-elect all embrace this concept. And we want to know more so that we can better provide for our citizens. So I will be asking some more questions in the future to make sure we move towards that.
I appreciate that. And I really appreciate that commitment. We've had a lot of struggles, with having that commitment to ensure that all our programs can be seen as that tool and resource for public safety and for our community. So I really appreciate that.
Mr. Robinson has his hand up.
Yeah, I guess first, Mr. Williams, that's really encouraging to hear. So I'm very grateful for that. 2 quick things. Well, I don't know if they're quick, but 2 things, and I do apologize. But I did have a lot. This is very important to me. I've followed this type of work for some time, even in my career. You touched a little bit about even recently about some of the ethical situations in officer cars, and Katie talked a little bit about the protected health information versus police reports. Was that becoming, well, it sounds like maybe it was. I can see that being an issue. And how does that come into play when you have people subpoenaing stuff? If you've got stuff going to court, how does how are you guys managing those records? And what is the line between, oh, this can't be used, or how are those things used?
Yeah, that's a great question, because we saw him a lot. We do a lot of case conferencing within the office with police and with fire and with EMS. A lot of the time to give back feedback that builds the buy-in, so they know that if they referred Camilla to a program, Camilla's working with her case manager and her social worker and her clinician. And we were seeing a lot of that kind of tension about what to share and what not to share. And so I think that with this model, what we've been able to develop is very clear guidelines that we will share with the new administration coming in, based on mental health, like what we can share, what social workers can share. And we also have CJIS, which is great for us. So that is a special it's a certification that we get for being part of public safety, where we can also now get information from police. So it's not only a one-way kind of conversation, but it's a dialogue. And now that the clinicians are together, they feel more empowered to say, I will share what I'm working with, that I'm working with Camilla, we're working on her goals, but I don't have to share specifically information that violates FI or their personal and health information. When it comes to subpoena, we've only had a couple of situations in the past 3 years. That is mainly handled by the law department. So they'll take a look at what is shared and what can be shared if it's relevant to the case. So I know that one of our clinicians was involved in a situation that was a domestic violence, and they were able to share from their perspective, but they didn't share any personal information about what they were working. So the law department's pretty good about guiding us through that, but I think that's a great question because we do see those kind of conflicts of
Yeah.
information sharing.
I want
And I
to.
guess, go ahead, Katie.
I want to just hit the clinical and ethical implications briefly. When I recently went to the CIT conference in Pennsylvania, what I was hearing from a lot of the clinical folks is they didn't have their own documentation system. They had to document within police records, which then means that anything that they're doing within their clinical perspective is now in a police record. And obviously you can,
Yes,
what that's
public.
so keeping that separate also then allows us, if we are subpoenaed, to assert privilege. And if it becomes, something that is involving law enforcement, our perspective is from the mental health provider. We're not speaking on legalities or charges, or do we think that this was a criminal situation? We get to really then protect the privacy in the best ways that we can. And again, it sounds like pretty well that there are very different implications for sharing information when you are in law enforcement situations, emergency situations, and then things that we're able to also make sure that we're educating them on, like mandated reporting and child abuse and elder abuse. So I will say that I think we're, to some degree, light years ahead of these other police departments that are just saying, hey, this is kind of what we're working with. You guys document in our police system. But to me, that really is something that, we're very lucky that we have the opportunity to keep those separate.
And thank you. Great to hear all of that. So I appreciate that you guys, the city is actually kind of in front of that, maybe more so than in some other places. And I guess related to that, in my day job, I work with an organization that is a Stop the Violence recipient.
Mm-hmm.
And obviously, I know there's some changes going on with that. And I know my organization is still interested in pursuing some of that work as they switch to these contracted services versus grants. You mentioned a little bit about working with them. I'm just curious, how do you view that collaboration, working with those either violence prevention organizations, violence intervention organizations? Just curious what the framework looks from there, because I could see a lot of positive stuff. I think a lot of opportunities are on the board there with that.
Yeah, we have a program called the Trauma Survivors Assistance Program, and we work very closely, particularly with a lot of the Stop the Violence organizations, and we will defer to them, and then they will call us in. So we've always really focused on community knows best. Community's been there the longest. Community will tell us once they need us. And in a lot of the times, public safety will send us and we'll collaborate. So we work really closely with Center for Victims, Neighborhood Resilience, REACH. REACH was key in one of our cases, one of our crisis cases. So a lot of those organizations, we really value their expertise. So we have been collaborating in different programs. I had prepared other slides, but we can come in the next meeting of our other programs. But we value those community organizations, and a lot of the time they're providing us with a lot of on the ground information about what we need to be, what nuances we need to take with specific neighborhoods. We launched a program in the summer. We're doing hiring for it right now, called Community Resilience Program. And that came about seeing the need of that clinical trauma with community organization. And so that is a team that will also be deployed to work with community organizations, help them out to not only be advocates for their community, but get them into spaces to bridge that gap, right, between community and government, make it more accessible so we can be that vehicle. So there are a lot of opportunities.
Thank you.
I don't know if any more questions.
No one has their hand up.
Well, all right. I'll end then. I wanted to make sure I didn't want to monopolize as I'm monopolizing. I guess this lastly, I don't even know if this is a question, but I'm not sure if if you've had this presentation to council, but I definitely, hopefully this would make them see this a little bit different, especially as we look at budgets. And I know some of the efforts that have been floating around looking to kind of draw back some funds. I hope that this presenting this way, I hope would address some of the concerns I've heard from council members, but also similarly sharing this in the community. And so I know I shared a little bit about what's presented at the zone council meeting in 5. I think Director Pittenger heard a similar presentation in another zone, but I think this would be way more impactful. I think it would address a lot of concerns from the community. And so obviously council's got to hear this, but I think community members need to hear this as well. And through those zone council meetings, you often can also get some of these Stop the Violence recipient orgs. So we can people can kind of share how this benefits everybody.
Yeah, I had the opportunity to go to council was it last week or the week before? And we were able to tell them this. They were a little bit confused, and it was great after that meeting because I think they all were very bought into, understood, like after showing them the way we presented this, this presentation. So I know that present was Deb Gross, President Lavelle. I think they were all there except for Councilwoman Kell Smith and Councilwoman Wilson. But we have been talking with their chief of staff, working very closely together. And recently we did go to the Hill District to do a community presentation to the north side. So we are going to different communities. And I think that overwhelmingly, people have been very supportive of this model from our past 3 community meetings that happened in the past 3 weeks. But I think it was communication, right? How do we communicate this effectively and for folks to understand when there was some kind of false information being shared, to be honest.
I don't even know if it was false. I think it was just omitting some. It was,
yes.
To Mr. Williams' question about why this was made.
Yes.
It was kind of got the taste that, oh, we don't have enough.
Yep.
And now we're going to pivot and do this. Not, oh, there was data that also matched with this. It just happened to be that was another factor, but that wasn't the deciding factor. So I know at least in home, this was in zone 5.
Yep.
I would welcome you guys come out in January, sometime in the new year, to talk with that group as well.
Definitely. Thank you.
Right. And again, my apologies to the rest of the board. I know I've asked a lot of questions, but I appreciate the opportunity to do this. And that we weren't able to get last month. So thank you.
Director Pittenger has her hand up.
Thank you. I also want to thank Camilla and her team for coming tonight and presenting this. You know, I come from a very strong background of advocacy for people in a varied ability community. And this particular issue in community life has always been something that we've never found a way to deal with. And we burden the police with it all of the time. And I respect, you know, how you've framed what you do and how it can be supportive to not only to the community at large, but to the officers. And I think that with this change, we lost a little ground with the buy-in with the officers, because now it kind of fell back on them. And maybe you'll get there, maybe you won't. The consistency with which your team is available to them is uncertain. And I think that we lost some buy-in there, because you had a momentum going with officers really kind of, you know, latching on to, hey, this is viable, this is a good idea, this is actually working, this is taking a burden away from us that we're not trained, interested, or competent to provide these interventions. But here is a group that can. And I think that's unfortunate. That was a cost to the change. And with everything, it takes time to recover, and it will. I've also been harping, and I know I've been nagging you about this, but in entering these austere times, the statutory requirement to provide this kind of human service support rests with Allegheny County. And while we're saying, well, yeah, you know, we're working on billing and all of that, if we, as the city of Pittsburgh, this office in the city is going to become a provider of human services, in which you described the whole gambit of community needs, human service needs. You've got aging in there, you have children and youth in there, you have mental health, behavioral health, you have, to some degree, intellectual disabilities, and you have the whole range that you described in your presentation. We have a whole system of providers, a network within this county that has operated for years. Now we are proposing to become one of those providers. What can we do? Or when you approach city council, how do we encourage the political buy-in and then the demand that our people in the city of Pittsburgh receive the same services as everybody else in Allegheny County, and that we're paid for providing it? Since they didn't, we need to be paid. That has to be offset. And you're proposing to go, further into expanding the services, which, yes, of course, we need it. The police side of it nurturing their caretaking role and like developing that even in imagery and all of those good positive things you're doing. But how do we get those people to pay for what we're doing? Where does that stand?
Yeah, I think that's a great point. That has been a priority for the office. So because those conversations with the county have gone well, but they've taken a lot of time, right? We haven't gotten like, yes, you're going to become a provider. This is a way that you become a provider. We've had to really diversify the way we fund ourselves. So a lot of our programs are funded by the federal government, and we've recently gotten a significant $2 million grant from DDAP, which is the Department of Alcohol and Drug I can never get these. There's so many acronyms. DDAP from the state, to get $2 million to have a diversion center to provide more support for police in those PM hours because there's nothing in the county. Like, that's the problem, right? We're getting a lot of pressure to expand to the nighttime, PM and weekend, but there's no county services that are offered during those times as well. So again, we're trying to fill that gap. What I will say is that we did apply to an RFP for their opioid settlement fund. The city gets an opioid settlement fund. It's assigned to us. It's very, very small. It's very small. The county gets 25, 30 million. So we did apply to an RFP. They've asked us to apply to fund that post-overdose support team that we've been getting funded through the federal government. And recently, for our Roots program, that's been funded through ARPA funding. But we all know ARPA COVID money is going to run out in 2027. There's a RFP that just came out for outreach. And the way that it looks like, it's mirroring what our homeless outreach team is doing. And we have been such a good partner to the county. So Nick, who's here, is our grants are like, I think we've gotten 6 million grants just in the past 2 years. And so we are also applying for that. So those two RFP will make us the county will pay for those services for us. So that will eliminate also the burden. But I think for crisis, what they've let us know is the best way to start is through this billing through Health Choices and OBH. They are going to change the way that those guidelines come through SAMHSA and through them. So I think we're moving in the right direction, but I do agree. I've been working really, really hard these past 3 years to have a good relationship with the county. We have a really strong relationship. We've done case conferences that we've never done before, which has allowed us to get information from their databases as well. So we can now access Client View, Epic, which has helped a lot of our clinical work. So I think that, these past couple of years, we've been building up that relationship. And I am sure, I think what we need, obviously, is for people in leadership above me and people from organizations as strong as the Police Review Board to keep advocating that these services in the city are needed and they need to be paid for. We've had to really be creative to how we fund them and not be a burden on our taxpayers.
So that's its challenge. Remains to be a challenge ongoing, and we're uncertain how we're going to sustain this, but we pretty much agree that we should do everything we have to do to make it.
Yes.
a routine part of the community and the response system that we have.
Yep. Yep.
One of you might want to approach the police too, to have an opportunity to speak to the Citizen Police Academy.
Yeah.
Because those individuals that attend that, they become the diplomats. They become, the ambassadors back to the community to say, this is what's available. This is what those people do. And if you see
Yes.
that it's the right thing, they're doing it the right way. Those are the folks, and that is a great opportunity to get your
Yes.
information out there. And I won't belabor this, although we could probably keep you for a couple more hours, but I'm not sure the board would appreciate that. How could our investigators, how would they go about making a direct referral?
Yes.
We encounter the same people the police encounter, many of whom you probably know,
Mhm.
but we often run into situations where they're isolated. They don't have any kind of support at all. And we think sometimes it might be in
Yeah.
your area. How could we go about doing that?
Yeah, so Katie and I talked about that, and we're going to be creating a link for you guys specifically that will come directly. Katie, if you want to talk more about that Gelada link that we're going to create for the referral process.
Yeah, I believe I see Nicole on here. I think we've talked a few times. So again, just briefly to hit on the importance of privacy. Anyone can make a referral from the police review board, public safety, city council, PLI, all kinds of different organizations that encounter folks. We will take that referral if your folks are willing to consent to have their information sent to us. And we can send you that link. I know we've been working through email, but we will make sure to give you a link that's similar to the other links that organizations have. Once we receive that information, we can let you know that we received the referral. And after we talk to that individual, it really does depend on their consent with what we can share with you. So just like if I were your doctor's office, without that person's permission, I can't necessarily share what specific place they were referred to, but what we can do is let you know what we have done. And again, if that individual is comfortable sharing those things, we are more than happy to provide that update. But again, for us, this is another reason that we try to make sure we're separating things to ensure that, we keep the trust and privacy of individuals that are working with us.
And
We
adding,
certainly understand that, and we respect that.
Yeah.
We do have some pretty strict confidentiality
Yep.
rules on us, so
Yep.
we do appreciate it. And Madam Chair, I think we can probably thank our guests, unless you have further questions or members want to pursue anything.
Nope, I do want to say thank you very much. This was very informative. And we look forward to working together as a team.
we are too. Thank you for having us, and we can come back and talk about the other programs, Beth, as well, if you need us.
Okay, terrific. Thank you. Thank you all. Stay
We
safe.
Thank you so much.
appreciate that. We appreciate it. Thank you.
Thanks.
Hi, Nick. Bye, Nick, since you didn't get to say anything.
Thanks for your time.
Well, thank you, members. I'll continue here. We have our two newest investigators. I think I gave Ms. Muller short shrift at our last meeting. She is with us now. She came on in the middle of October and has been joined with Krista Tagan, who is our newest investigator, who comes to us with a background in, I guess at some point a parole officer. She's worked with in corrections, and also has a Bachelor of Science in Psychology with a minor in sociology, with a master's degree in criminal justice. So we have two new team members that have just already proven. Ms. Tagan started November 3rd, I think it was. So they're still sort of new, but they're a fantastic addition to our crack team of investigators, joining Ms. Hunt and Ms. Edwards, and certainly under the tutelage of Mrs. Michelle Kirchner. We're delighted to have them on board. It's been very nice having that kind of interest in what we do and bringing their own experience and the freshness of their perspective. It's just been wonderful. So welcoming them.
If you make
Our
it-
intake
yeah.
for, as of yesterday, was 224. We have opened 2 executive director inquiries related to incidents that actually received some public media attention. One is an officer, a sergeant actually, who was arrested for a second driving under the influence. This most recent incident happened last week, and it occurred in Plum. And apparently, he is charged with a DUI. He is suspended, or he's on leave. And I don't recall his date coming up, but it's soon to determine what will happen with his the criminal charges. However, administratively, this is his second DUI. You may recall that a couple of years ago there was a hit and run of a WPXI reporter, Amy Hudak. Turned out that it was one of our police officers. He did go through a program so that that was mitigated. But this is his second, and apparently it does rise above a misdemeanor level. His BAL was 0.308, and that's pretty high level. So he has a problem, but he is on leave. The second incident happened last weekend with an officer involved domestic violence incident. It happened in Dormont. The public story is that the off-duty officer, was trying to stop his wife, who had been drinking, from taking the children and driving in a vehicle. Dormont police did effect the arrest. Now, administratively, there are 2 major standards. One is in the city code. It is 116.02 in the city code, which deals with the public safety responsibility when there is an officer involved in a domestic violence incident. And within the Pittsburgh Bureau of Police, it is operating standard 40-12.1. Both of those things came into effect in 2007 following a very public and a very intense campaign to create these standards within the city of Pittsburgh, leading to a zero tolerance of domestic violence from city employees, particularly police officers, as a result of an incident that had happened back then. But it ended up being codified, and the Bureau adopting its own policy as required under the city code. So there are very stringent requirements placed upon this investigation internally, administratively, and there is also the outstanding criminal matter related to domestic violence. And I believe that that person's hearing is coming up. I think it's the 17th of December. Our investigators are following both of these cases, and so they'll attend those hearings as they come around. Since we met last, we did have our budget hearing with City Council. It was November 20th, and that went well. A lot of interesting conversation. We don't anticipate any significant impact. Again, our discretionary spending is very, very minimal. And we're not anticipating any kind of cuts that will be devastating to our operation by any means. We're good, we're solid. The only increases were related to personnel, and those are things that we do not have any direct control over. And we had our Office of Community Health and Safety presentation. And I think that is it, other than to acknowledge that this is our last meeting of 2025, and to acknowledge that Mr. Williams is the nominated public safety director under the incoming Mayor-elect's administration, Mayor-elect O'Connor. I do not know when that inauguration is going to take place, but I have this feeling that this may be the last meeting that we will have the expertise of Mr. Williams at the table. And I can say personally, that's breaking my heart, because he's been here a long time, and his contributions have been significant and very, very substantive.
Well,
But
he could come back every month and give us an update, right?
I think that's a great idea. That's one of the things we're going to ask of him and the chief nominee, Mr. Lando, to provide a presence at each of our board meetings in the future, so that the department and the Bureau will be well informed as to what we're doing, and that you will have the benefit of having a representative guiding us as well. So we're looking forward to this administration, and Mr. Williams, Godspeed. You are a wonderful nominee. You have anything we can do to support you, as you know, as well as it's consistent with our mission, we're there. You're one of our own. Moving on.
Absolutely.
I have some comments, but should I wait for new business at the end to do that? I'm more than willing to do that.
We're getting towards the end anyway, so it's unfinished, old and new, before we go to cases. So it's yours.
Well, Beth, are you finished with your report before I?
I am finished with my
endeavor?
report.
Okay. For the board's awareness, I know we have some newer members. I just wanted to say that my time here at CPRB has been rewarding. My decision to be a member on this board was birthed out of my interaction with the CPRB as a police officer. I was subject to a complaint. At the time, the sentiment towards the CPRB was not very favorable. It may have moved somewhat up, a little more favorable, probably still has an issue here with our rank and file. But I want you to know that it was based on the handling back then under the direction of Director Beth Pittenger, the investigators at the time. Given the sentiment that I had and the culture that was set, I had one perspective about what CPRB represented until I had engaged with the board about my own complaint. And it was the total antithesis as to what was being said. So as I continued in my career, I had a newfound appreciation for the accountability aspect of what CPRB represented. And then upon my retirement, after being nominated and asked with some careful deliberation, I decided to come on to provide the expertise that I could bring forward to better inform this board, to make sure that the functions and the duties that we have as a board will be carried out as the public expected. And so for the 12 years, I think I've served, 11 or 12 years that I've served, that has been my burden. It's just to provide that very specific perspective to give both, whether it's legal or experiential, so that the board can make its best decisions moving forward. And I have nothing but high praise for being a member of this board, but for what this board represents. And I look forward to encouraging better opportunities for this board to do what it needs to do. I think it is a true testament. It's a model. I've heard it throughout the country as to what Pittsburgh has provided. And even though sometimes it feels like, what are we doing sometimes in our meetings and stuff like that, we are very valuable to the citizens. So please embrace that. I do leave here as a friend of the board, and to make sure that there will be no barriers from you being able to perform your duties moving forward is my commitment to this board. So I do leave here in my comments that I've appreciated being a member of this board, and I look forward to the opportunities to collaborate. And I want to also say, you know, for the many members that have come back, for our investigators, they know. For the new ones, maybe you don't know, I've always had care and concern about our investigators throughout the years, about our board members and stuff. I love that we can deliberate on things, that we can wrestle through things. I hope you encourage that. Bring your own personal perspectives. That's what makes us a board, and that we share this stuff. So I've appreciated some of the discussions and stuff. But I also want to say, you know, for Beth, I mean, I say this with the deepest part of my heart. I have a great fondness and appreciation for you, your heart and advocacy towards community. You have been a champion for many years. You're invaluable. I know Steph and the rest of the board are following under your leadership. They have a great mentorship under you. And Pittsburgh's a lot better off because of your efforts. And I just wanted to personally and publicly state, I appreciate what you have brought and your leadership and directing this and all those who have come on board. And my last thing is a point, I think every law enforcement person that comes on there, their name ends in N. We had Karen, now we have Karen, we had Norman, now we got Sheldon. I think the next person come in, their first name got to end in N, I think.
We got to work on that with the mayor and council.
Thank you, Mr. Williams. It's ironic that I believe it was 11 years to the day that you were appointed. Well, at least the last appointment that was official. You have been retained since, however, December 2nd, 2014. And here it is, December 2nd, 2025. God bless.
And thank you, Sheldon. And I'm going to really miss those hugs. You give the best hugs there are. I'm going to miss them. I'm going to have to come to your office for one, I think. Thank you. Thank you so much for your service. And, you know, bringing the perspective of a police officer has really, really helped me over the years. And I appreciate that. All right. Anybody else want to say a few words to our parting?
Yes, quickly, I will. Just one, I was elated when I seen the announcement. I was like, oh, I know him. Not only that, I was also surprised. I did not know your full background. I did not know you've dabbled in emergency medicine or medics and also the fire. So I'm curious. I don't know if we've had a public safety director who's had that wealth of experience. I think we've had one that was usually come up through one of those. And then not only that, but the experience that you'll take to that role, as kind of what just mentioned, from your role here. And so I think I don't know if you can have somebody more qualified as a public safety director from what I've learned of you over these last couple of weeks. Obviously, my knowledge of you working with you here specifically on the board, I've appreciated your perspective. I think we've often had different views on some things, but I think you've been able to enlighten me about some stuff and definitely help me and how I carry out my role with this board. So yeah, looking forward to seeing what you do with the city for the city. Yeah, congratulations.
Thank you, Ms. Robinson. To be fair, Director Hisrich did have police, fire, and EMS in his background.
Okay.
What the uniqueness that I bring too is that I have a counseling background, a community leader background through my pastoral, which I think is very helpful for this post as well, and a business background. So, and I'll share, you know, because all those things I think will be helpful. I think it's my love for this city is where I bring. That's my biggest asset. I love this city. I love the citizens of this city, and that's what's going to make me work hard to make sure that we provide for them.
Thanks.
We have no doubt about it. No worries there. You got this. Thank you so much. Anybody else? This was a long board meeting tonight, folks, but that's okay. I don't think, do we have any unfinished business? I think we took care of that last month. We have no old business, and our new business is our old members going on to bigger and better things. But promises to visit us at least once every year, right?
I promise to visit upon request. I'll come in and provide updates. You have no issues there, but as the board will have me, I like to step in and just hear what's going on so I can understand what's happening in and around more than the public's perspective. I know I'll get that information directly, but I also want to know public perspectives as well.
Yeah. Just know that you're always invited. Our door is always open to you. And we appreciate you. Alrighty, if nobody has any qualms, we'll go to the case review. We good with that? And so we have a total of 9 cases, and we have no public hearing. We took care of that a couple months ago. Unfortunately, we didn't have a big turnout, but the people that did had something to say. But we have 2 full investigations this month, number 166-25 and number 159-25. May I have a motion?
Quick question before we get there. I don't know, Steph, are you able to bring up the list? It looked like there was a mistake on the list.
In the beginning? In the beginning of the list?
Yeah, where's 13125?
I'm getting ready to bring it up. Give me a second. I'm just having difficulties.
I'm looking.
It looks like on the
It's under
summary,
the
it's
30-day
listed as
extension.
dismiss, but the actual case review note says full investigation. And just looking at the numbers in there, the numbers don't seem to match up.
Okay, 131-25 is a 30-day extension for full investigation. There's two of those.
Maybe I'm mistaken. Huh?
Well, no, the remark is there's insufficient evidence to prove the allegations that the officer violated the PPP policies and procedures.
Yeah, I guess my question is that accurate? Because it looks like when you look at the actual
I see what you're saying.
case note,
The recommendation is not correct.
correct. Yeah, okay.
It is
So
a
we have
30-day.
three. We should have three for full investigation. Is that correct?
131.25. Is that what you're asking, Mr. Raymond?
Yes.
Yes.
That should be under a 30-day investigation, but it's recommended to dismiss as unfounded. That's incorrect.
Or maybe there was an update because what you're
Let me look.
sharing.
I can pull the summary, unless you have it, Beth.
No, I think the issue is the recommendation is for it to be dismissed.
It's unfounded, but then we're saying it needs 30 days full investigation.
For an extended investigation.
Yeah, sorry.
I think it is, I think that the dismissal is what it should be. Or
Okay, so
Stephanie, you're saying no, that it should be the other way around. I
she's
have to
saying,
pull it up itself.
Correct. I just pulled the summary.
Yeah.
And it should be 30 days.
okay,
It should
I
be
can share-
an extension of a
Yes.
full investigation extended with 30 days. So the recommendation is
Wrong.
revised.
Yeah, so that should read authorized 30-day investigation.
Correct.
Instead of authorized dismiss as unfounded.
Yes,
Okay.
yes.
Okay, and I might have got ahead of myself, but I just wanted to point that out.
No, it was very
No.
helpful. Thank you.
Mr. Robinson, that's a good catch, but I want to, as a matter of order, because we've been given this list, should we make a motion to amend that to read correctly so that we can adopt it under the right, framing and vote it in?
Yeah, so that would be on the second one, right? We got to just change
Right.
the unauthorized to authorized 30-day. So when we get to that, we'll make that adjustment, right?
Correct.
All right, you good with that, Sheldon? Okay.
Yeah, I'm
cool.
good.
So the motion present was for the two.
That's correct. For the full investigation to it.
Yes.
So we got a motion. I think we had a second, didn't we? All in favor? Aye.
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 Opposed? The ayes have it. All right, and then we have the 30-day extension of full investigation. There's two of them, 155-25 and 131-25 that during discussion needs adjusted or addendum. All right, so do I
I'll make
have a motion?
Is this a two-part motion though? Like I will make
Yes,
30
two-part.
day. Okay, two-part. So I'll make the motion to accept 155-25 for 30-day extension, and also to amend 131-25 for where it's stated in our docket to authorize 30-day investigation as well, and to negate the comments next to it about
Yes.
insufficient.
Perfect.
Yeah.
Do I have a second?
Second.
Any further discussion? All in favor? Aye.
Aye.
Opposed? Ayes have it. We have three that are unfounded. -042-25, 031-24, and 004-25 ED. Do I have a motion?
I'll make the motion.
Thank you. Second?
Second.
Thank you. Discussion? All in favor? Aye.
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 Opposed? Okay, the ayes have it. Then we have 0 unsustainable, and then we just have 2 suspended. And that is case number 127-25 and 111-25 ED. Do I have a motion?
Make a motion.
Thank you. Second?
I'll second.
Thank you. Discussion?
I wanted to talk about 1125 ED.
125 ED. Okay, go ahead.
Yes, just had a couple questions on it. I saw that we did issue a subpoena on 9/24 for the officer's statements. Did that subpoena include for the body worn camera footage? Because I see that have been requested multiple times, but we haven't received it yet. And then my second part of my question is, now that the individual is no longer facing any criminal charges because the district attorney's office withdrew the charges, would be anything impeding in receiving that body worn camera footage for review, simply because of the public interest around not only was the individual paralyzed, but just the interaction.
Beth, you're on mute.
Yeah, Beth. And so the body worn cameras, I don't think we have resolved yet, correct, Alex?
Correct, but I think Beth was
Muted.
saying a lot more there.
Okay, sorry,
Yeah.
Beth. Go
No,
ahead.
that's okay. I was not attending to my audio there. It is a city policy. It has been a city policy, a city practice to deny us access to body worn camera video. It has nothing to do with the criminal charges. In the past, that we have been permitted to view the video, but you will recall that for the last 2 years we have been struggling with the city and with city law department, where we thought we were close to having an agreement, and then the city solicitor left. So that's fallen, and now we have to start all over again with working on an agreement with the city to allow our investigators to observe body worn camera video and to receive additional documentary evidence that they have that they started to withhold from us. So another reason why we're looking forward to a new administration coming in, where individuals who are aware of the struggles the board has gone through trying to obtain various types of evidence, that we'll be able to sit down and have a discussion and create a protocol that will facilitate the board's ability to receive a comprehensive investigation conducted by investigators who are enabled to view and receive evidence necessary to make those recommendations.
So my original question, so when you guys subpoenaed OMI, it wasn't included in the request for the body worn camera footage.
Nicole, was that particular subpoena, did it include a subpoena for body worn camera video? I believe Nicole is the investigator on that case, Mr. Davis.
Pittsburgh Bureau of Police is who we subpoena to get the body worn camera footage from. OMI is just, my understanding is we just subpoena them for the officer statements.
That is correct. So, Mr. Davis, you're really asking, I mean, the next would be that you're asking if we had subpoenaed body worn camera video from the Pittsburgh Bureau of Police?
Yes, Director Pittenger.
And is that, Nicole, did we submit a subpoena to the Bureau for that case?
I believe I did, but I'm not sure. I just know that, since this case started, we haven't been able to get anything from them prior to this case happening.
Yeah.
They haven't given it, PBP hasn't given us anything. no access to body worn cameras or no access to paperwork documents.
Thank you.
I just want to give a quick, obviously all of our investigators does a wonderful job, but to Investigator Edwards, you did a phenomenal job as far as doing a lot of groundwork in relations to this. So I did want to give you credit where credit was due. As far as this particular one, I was going to ask the body if we could just extend. I know the recommendation is suspension, but extend it for another 30 days until a conclusion as far as the request for the body worn camera footage comes in.
Well, I think we suspended, and that's what means it's in suspension until we get some stuff. So I'm not sure what you're asking to do, move that to another category?
Yeah, I'm just asking for an extension of the 30 days full investigation until until there is a conclusion on the body worn camera footage, which I do see is the rationale. Also under this suspension, and I wanted just to get clarity, if we go to suspension for this, does it not have an end time date? Rather, if we just leave it as a full investigation for 30 days?
I believe the case has already gone through the 30-day extension of the full investigation, which is why it was moved to suspension. And that suspension, you receive an update on a monthly basis. And there's no drop dead time on the suspension. It is recommended to suspend until such time as the specified criteria has been met. And if it hasn't been, then you'll see it recurring on the suspension list on your case review agenda monthly. Where we know that there's something coming up, there would be an automatic update to you in a summary form. If, for example, it was suspended pending a trial that was going to occur, a couple of days after your board meeting, it would be suspended so that they could report back what they learned at that trial. So there's no drop dead date on the suspensions. And you're given the status update of that every month. So the issue about the body worn camera video, which we had hoped to have had resolved by now, we will renew that. Mr. Wright and I will have a discussion with the incoming administration to determine what standards could be applied to investigators' access to things like body worn camera video. And it's worth noting here, just limitations on access to body worn camera video comes from Act 22 of 2017. And in that statute, it creates a separate track for requests for information. It doesn't fall under the usual Pennsylvania state open records laws. There's a separate protocol for police-related stuff, including body-worn camera video. And if you wish to see body-worn camera video and the chief decides, well, you have to submit a request for it, you have to go through specificity within a certain, I think it's 60 days, and it has to be specific to the people involved in that video, the time, the location, and the duration of the video that you wish to see. It's a very onerous process, and the state legislature set it up that way, and they're the ones that should be they should be lobbied to change it, because it's withholding very important information from the public in Pennsylvania. In our case, it's withholding information from our people who have an obligation under city law to conduct an investigation, which includes, evaluating evidence and providing you a recommendation. We had established a protocol that our investigators were permitted to view body-worn camera video. It's the chief's discretion. The chief set it up, had them do it, and that was fine until about 2 years ago. And then under this administration, it was determined that our investigators would no longer view that body-worn camera video. OMI does have access and often can dispose of cases based on their observation of body worn camera video. And that's something that our investigators don't have the advantage to see. So that's what we embarked 2 years ago with the city administration, with the law department specifically, to create a protocol that would lead us to a place where our staff could see what they needed to see. Mr. Wright and I had met, or we had discussions with the law department to come up with the protocol, and they just kept changing it until ultimately the city solicitor left. There was no draft. There was no further discussion. Even though we were promised one, there was none. So we were kind of left with nothing. So now we're awaiting the new administration so that we will have a city solicitor who we can work with and at least start out from the beginning to establish that protocol. It's frustrating, Mr. Davis. It's very frustrating for our investigators. And it just doesn't, there's no rationale for it. That, what are you hiding is what you end up asking. It becomes a suspicion, and that's not fair to anybody. So I guess I just vented unnecessarily, but hopefully this new administration, we will be able to establish from the get-go a mutual understanding as to what the obligations are of the board under the charter and the ordinance, as well as the obligations and responsibilities of the city, and particularly the Department of Public Safety and the Bureau of Police and the Office of Municipal Investigations, as expressed in the charter and the ordinance.
So Beth,
Thank you.
instead of us going through court like we were going to take this, we're going to have a conversation first. If need be, we go to court. If not, we just, if they're open to it, if Jason's now, because apparently when he was here before, there were no problems with the camera and having access to it, right? I mean, because this just happened in the last couple of years.
This only happened in the last 2 years. Yeah, we were cut off completely, and yeah.
So this may not have to go to court, right? This could just be a decision between Mr. Williams in his new position and Jason in his new position and the mayor, and maybe having a discussion.
That's correct. That's correct. We chose, that was the reason we didn't go to court, was because there had been an open hand and an invitation to let's resolve this. And we tried to.
Right.
But obviously it didn't work. And just as we were on the threshold of a protocol, poof, gone. No more discussion about it. So.
Yeah, well, there's no solicitor. What do you do?
The individual who was supposed to pick up on it, we never had any further discussion with that individual. So we would not get anywhere by going to court tomorrow to file a motion about it. We would still be in the same boat in terms of the process takes a while. So we're much better off, and the public interest is much better served if we can arrange, have the discussion with the administration so that if there's a mutual understanding as to what our obligations are, both sides, and we can construct some protocol that will satisfy those obligations.
Okay. Thank you. So I think we got them all, our case studies. The other ones are just informational. And I don't
we need to vote on the two suspended.
Oh, okay. I'm sorry. So we had a motion. We had a second. We had discussion. Now we're ready for a vote. So on the last two, for suspension, 127-25 and 111-25 ED, we need a vote. So all in favor? Aye.
Aye.
Opposed? Okay, the ayes have it.
Abstention.
I'm gonna abstain as well.
All right. So
Yeah.
okay, thank you. 2 abstentions. And the rest of them, there's, I think there's 20 of them? 19 of the informational. that we do not vote on.
I had a baby come in real quick before bedtime. So just give me 1 second to just say one last thing with respect to body worn cameras and video surveillance of any kind.
Okay.
Litigation in that sense is so protracted and complicated and long that to the extent that we can work something out, I know it may seem like it's a delay right now, but that delay is nothing compared to what the delay would look like if litigation ensued. So just bear with us, please. We're going to continue to work through it, and hopefully there's light at the end of the tunnel with the new administration and new decision makers in charge.
And I think
I just wanted to say one thing. I just wanted to say, thank you to Investigator Edwards. Again, the packet was well informed, and thank you, Director Pittenger and Mr. Wright. My question was just basically out of curiosity, because I saw that a subpoena was issued, but only for statements. And then I saw the difficulties on the back end that the investigator was having as far as multiple times throughout, investigating the incident, that the body worn camera footage was requested. And so just trying to have a better understanding of that process as to why or why not. And I appreciate the explanation from Director Pittenger and from yourself, Mr. Wright.
Mr. Davis, if I could also just clarify, when the subpoena went for officer statements, that process is the result of a protocol established by court order issued in 2004 that we agreed when a case went to full investigation. At that point, we would issue subpoenas for officer statements or whatever we needed from what was officer statements was specific, whether it was subject officer or witness officer. That at that time, when you ordered it to a full, we would issue the subpoena to OMI so that they could provide those documents to us without fear of violating anything else. So that was pursuant to a court order from 2004. And that's why you'll see the subpoenas issued for officer statements.
Thank you.
You're welcome.
Righty. Well, again, our next regular meeting will be January 27th at 6 o'clock. Again, it will be virtual till we get through these winter months, and then we'll be back out in our communities.
Do we have one more vote though on cases though, Dr. Gershio?
I don't think so. I don't
Okay.
think I missed any. The last ones we don't vote on. They're just informational.
Oh, okay. Yes, right. That's
Yeah.
right.
All right. Okay, so does anybody have any new business? We know that our next meeting is January 27th. I'm going to wish everybody a happy holiday, safe holiday. Hope everybody had a great Thanksgiving. And before we know it, it will be 2026. So everybody have a safe, enjoyable holiday, and Godspeed to everybody.
Before you guys adjourn, Tris and Mark were online, but they left early. They actually had a real date. They had the symphony this evening, but wanted to pass on happy holidays to the board and their gratification for all that we do.
Thanks, Stephanie.
All righty. Do I have a motion? Well, you had a long meeting tonight. It's actually 8 o'clock.
Wow.
Our meeting. Do I have a motion?
Make a motion.
I'll make the motion.
I got a 1 and a 2. I heard them.
Yep.
There you go.
All in favor?
Aye.
Aye.
Aye. Enjoy, everybody. Sheldon, Godspeed, and we'll be checking you out.
Thank you.
All right.
Hey, everybody.
Congratulations, Sheldon. Couldn't happen to a better
Thank you.
guy.
I agree.